Started. S- Thank you. So, greetings, everyone, and welcome. Thank you for attending tonight's discussion about heart health. My name is Sheridan Jack Brown. I am a proud member of Zeta Phi Beta Sorority Incorporated, Sigma Kappa Zeta chapter, which is located in Brooklyn, and I'm also the chair of the Zetas Have Heart Committee. Before we get started, I would like to pay homage to our five trailblazing founders who laid the foundation and paved the way for us to champion women's rights and issues through our principles of service, scholarship, sisterhood, and finer womanhood. So, cardiovascular disease is the number one killer for all women and adults altogether. However, Black and Brown women have higher rates of heart disease than other women in the US, and we are more likely to die from it at younger ages. Currently, 59% of Black women ages 20 and over are living with some sort of cardiovascular disease. So, to address this issue, the Zetas Have Heart program is designed to increase our awareness of heart disease and support Zeta members and the community at large in getting fit and becoming more active as a way to combat heart disease. In line with the Zetas Have Heart mission, tonight's discussion will provide you with information about heart health to help you make informed decisions about your personal heart health going forward. So before I turn the floor over to Sora Carroll to introduce tonight's distinguished guest speaker, please take a moment to mute your mics to prevent, the interruption of back noise during our virtual time together. So once again, welcome and thank you for joining us tonight. Sora Carroll, the floor is now yours.
Thank you. Good evening. My name is Shirley Caro, and I'm a proud member of Zeta Phi Beta Sorority Incorporated and Sigma Kappa Zeta chapter right here in Brooklyn, New York. I'm also a member of the Zetas Have Heart Committee. Tonight, I'm very honored to introduce my dear friend, Dr. Hassan Tedder. A native to Brooklyn, New York, he received his BS from SUNY Plattsburgh, which is where he also became a member of Phi Beta Sigma Fraternity Incorporated. So yes, we are elevating the bond tonight. Thank you so much. He received his MPA, oh, actually, I'm skipping something. He received his MD from SUNY Downstate Medical Center, his MPA from Harvard's Kennedy School of Government, his MBA from Johns Hopkins University Carey Business School, and finally, but not least, his MS in National Security Strategy with a concentration in artificial intelligence from the National War College. Dr. Tedder is a heart and lung transplant surgeon and a retired U.S. Navy captain with over 25 years of dedicated military service and global deployments. Thank you so much for your service. He is an associate professor of surgery at the Uniformed Services University of Health and Sciences, an adjunct faculty at Howard University College of Medicine, and a professional adjunct for the Johns Hopkins Carey Business School Center for Digital Health and Artificial Intelligence. Dr. Tedder is a founder and principal of Tedder Consulting Group, creator of the Art of Human Care book series, and is a best-selling author of several books. And now, in his spare time, Dr. Tedder trains and runs marathons, including recently completing an Ironman. Wow, that's very impressive. Dr. Tedder is also a board member of the American Heart Association, and we are so excited to hear from him today on the 3 simple steps to heart health. Thank you, Dr. Tedder.
Wow, well, thank you for that very kind introduction. I really appreciate it. I'm going to see if I can share my screen with you all so that I could display my presentation. Is everybody able to see that? It should say Zetas Have Heart.
We do.
Yes, we can. Thank you.
All right, excellent. Well, your introduction is way too kind and way too long. I really appreciate it. I like to just maybe begin by saying I'm just a little kid from Brooklyn. I had the honor and distinct pleasure of being raised by 2 wonderful parents who immigrated here from West Africa. My dad was from Ghana. My mom was from Sierra Leone. I like to start with that because I want to make sure that people know where I come from, and my dad would always say that I was made in the USA. They've both passed away, and I've lost them both. And I've learned the adage now that when you lose both parents, you are truly an adult. So I've been an adult now for a few years. But it is an honor and a pleasure to visit with you all to talk about something that is really, truly near and dear to my heart. I trained in New York, as Shirley mentioned, Sora Shirley mentioned, and I was very fortunate to be admitted to medical school. It was not an easy slog, and it was a great blessing to be able to come back to downstate, my hometown, and literally go to medical school just down the block from where I grew up. And while I was there, like many of the minority students that were there, we were all told that we should become primary care doctors because that's what was needed most. And I had the distinct honor of meeting an African American heart surgeon who came to visit and talk to the students. And I approached him after his conversation with us and just asked him a little bit about what he did. And he told me that I should come watch him in the operating room. And that was in my second year of medical school. And I saw this man that looked like me open up the chest, stop the heart, operate on the heart, and tapped it again, and it started beating. And I said, I want to do that when I grow up. And that's how this all came to fruition. So I've been the beneficiary of many, many great people in my life that have given me lots of support. And all of those foundational roots were definitely developed in Brooklyn and certainly throughout my brotherhood with Phi Beta Sigma and the friends that I've made throughout. I am going to give some perspectives on heart health, and I want to share a couple of personal anecdotes that I hope will resonate with everyone. And the talk is not very long, and what I hope this will do is generate a lot of interest and questions that we can address toward the end of the conversation. So to begin, I am on the board for the American Heart Association's Greater Washington region, and this talk is simply titled Three Simple Steps to Heart Health. This is a picture that captures a very special moment for me, and it will set the foundation for how I proceed with this discussion. Uh, I had the great fortune and luck, I would say, to be able to attend Harvard's Kennedy School of Government. And while I was there, I met some of my Navy colleagues who were in class with me. And on this particular day, we got to meet with the chief naval officer, chief of naval operations. At the time was Admiral Roughead. He is the gentleman in the middle with the uniform. We're all Navy officers here in this picture. And if you're trying to figure out who I am, I'm the tan fellow there on the right or left, depending on how you're looking at it. And while I was at the Kennedy School and sort of in the greater Harvard community, one of the things that I really appreciated about my time there was that there were really smart people there, no question, but I realized that they were not necessarily a lot smarter than the people I had already gone to school with and at SUNY and other places. But what I was really taken back by is how some of the most complicated things would be broken down into very simple things. And I think that was really the essence of what I took away from my time there. And that was to always try and take something complicated and make it simple. And heart disease and heart health is something that could be made very, very complicated. And what I'd like to do here is set the stage for making it simple so that there's actually actionable things that we can take away after this discussion that you can implement right away and put into use tomorrow and share with your friends and families to really make a big difference. And I would be remiss if I didn't mention that heart disease, as was aforementioned, is something that impacts almost everyone. It is the number one cause of death throughout the world. Women disproportionately suffer from heart disease, and I say suffer from heart disease because it's not necessarily recognized in women because they don't necessarily present with the classic signs and symptoms of heart disease, and so it goes underdiagnosed or misdiagnosed. And above all of that, unfortunately, African Americans and minorities are disproportionately affected by heart disease as well. I went to Brooklyn Technical High School, and I just learned literally just last week that one of my classmates that I graduated from high school with passed away because of heart disease. So obviously very young, and it hit home because it just gives you another sense of how devastating this disease can be, even for someone who is relatively young. So, what's the most important thing to you? And why should we care about heart disease? I am certainly biased with believing that the heart is the most important organ that there is. Certainly, lots of emotions that are tied to the heart. It is a sort of a spiritual organ, if you will. But from a functional standpoint, it does a tremendous amount of work. It beats and pumps hundreds of thousands of gallons of blood throughout your body throughout one's lifetime. And it is the quintessential organ for delivering nutrients, oxygen, and delivering life to all your other organs. Now, as a consequence of having heart disease, it can lead to some pretty dramatic and morbid things, and of course, cause death if it's not tended to. So here are just some statistics that come from the American Heart Association. I would have to give a shout out to the American Heart Association. They've done great work. That's why I'm proud to be a member of the board and spreading awareness about heart disease and the things that you can do to address particular conditions that are manageable and sometimes can be reversed in individuals. So just some very stark statistics here. If you think about heart disease and all of the things that happen when one has heart disease and what it leads to, you can see that in this 2025 update from the American Heart Association, again, cardiovascular disease remains a huge risk factor for disease and population health and morbidity and mortality. On average, someone in the United States dies of coronary vascular disease every 34 seconds. On average, someone in the United States dies of a stroke every 3 minutes. And stroke deaths are actually going up. The age-adjusted global death rate attributable to cardiovascular disease is pretty high, 235 per 100,000, and age-adjusted in the United States is 224 per 100,000. Like all of those numbers might not mean too much for you, but as I mentioned, if you think about your own life and family members and friends, almost all of us have someone we know or knew intimately that unfortunately succumbed to heart disease. And oftentimes, some of these things could be prevented. Not all the time. Certainly, genetics play a role, age, and things that cannot necessarily be adjusted or mitigated. However, there are some things that can be. And so the intent of this discussion is to really give you like I said, those three very simple things that you can do to promote heart health. But first, I wanted to raise awareness. What is most important to you? So this is a picture of one of my esteemed training programs, University of Minnesota. This is where I spent my time learning my craft of heart and lung surgery. And one day while working at the hospital, I was really, really sick. And we had a mantra back then that you were either in the hospital or you were in the hospital. So there was no such thing as being away or off from work. So you're either working in the hospital, or if you weren't at work, you couldn't call in sick. You had to be a patient in the hospital that sick that you couldn't come to work. Anyway, one of these days I felt like I needed to be in the hospital. I was really doing poorly. I probably had what was probably the worst case of the flu. And I walked to our school's infirmary at the University of Minnesota, and I passed this wall that I'd passed many times before. And this is sort of a picture of what was uh, posted on this wall. And it really, really resonated with me because at the time, nothing else really mattered to me. And when I read it, it really hit home. When health is absent, wisdom cannot reveal itself, art cannot become manifest, strength cannot fight, wealth becomes useless, and intelligence cannot be applied. And this was from Herophilus of Chalcedon. And when that moment when I read that, it really hit home to me that when you are sick, when you're not feeling well, nothing else matters. And it is not until we are robbed of our health that we really appreciate how important health is. And for me, this has been the foundation of how I approach and practice healthcare and my own life. And I always like to poll people and sort of illuminate how important health is. And so if we were in one of these live audiences, I would ask everyone to raise their hands if they believe that health was the most important thing. Again, if you're feeling good and you're feeling well, it's one of these things where you feel like, oh yeah, well, I can take it for granted. And I'm here to tell you, never take your health for granted because it's the one thing that when you have lost it, nothing else matters. So some more statistics to sort of put things in perspective. Again, very, very devastating heart disease, and it's impacting everyone, even our youth. 1 in 8 male adults, 1 in 10 female adults, even 1 in 10 students are using e-cigarettes. These are all these risk factors. These risk factors are causing and contributing to more heart disease. And when you look a little bit closely about some of the other risk factors, certainly overweight and being obese is a risk factor. And these things have contributed to not only Alzheimer's and coronary vascular disease. So CVD is coronary vascular disease. And you can see it costs billions and billions of dollars to take care of individuals with heart disease, not to mention the loss of opportunity when people are sick and no longer can work after heart disease, or even worse, succumb to it. So the 3 steps that I'd like to espouse that are very important are step one is to exercise regularly. And regularly means as often as possible. I know that many of us, myself included, have started exercise regimens and probably stopped doing it. And probably what's more important than doing a high intensity exercise, maybe once or twice a month, is doing something very small and something very consistent on a daily basis. That's probably the most important thing. And so you have a picture here of both strength training and also what we would deem cardiovascular conditioning, treadmill, running, and even simple walking. All of these things have been shown to absolutely contribute to heart health. So exercising regularly is step number one. Again, something you can do right away. You can implement that right after this call. You can start a very light exercise regimen tomorrow. If you're doing exercises right now, try and be more consistent with it and try and incorporate some strength training in as well. So number two is eating healthy. When I've given this talk in the past, I like to highlight that the body is very, very good at regulating what is good for you and what is bad for you. In one very sort of illustrative example, again, I would ask you as a poll, how many of you have ever been poisoned by food or ate something that did not agree with you? And many people will raise their hands and they're very aware of that. Well, it turns out that your body actually is very sensitive to the things that you put into it. Now, I am certainly not advocating that you have to be someone that eats only vegetables and only fruit or anything like that, but moderation is probably the most important thing. I have this picture here because it shows some of the foods and the kinds of ingredients that you should be consuming on a daily basis. So certainly salmon has always been a good source of protein. Fruits and vegetables, of course, are good. And a daily awareness of what you're eating and the kinds of foods that you're eating, I think are really important to contributing to heart health. So step one is exercise. Step two is eating healthy. That's the second E. And again, these things might all seem like, well, I've heard that before and it's intuitive, but I'm going to share with you sort of at the end why all of these things put together make it really, really important. And the last three of the E's is empower yourself. And I give all of you credit, the many of you that have joined on this evening to visit and to discuss and to learn about heart health, because this is the one thing that I try and tell all my friends and family is probably the most important thing. We have the most control over our health as individuals. And you should all think of yourselves as the CEO of your health. Doesn't matter if you have a great doctor that you've been going to for years, if you have a great surgeon, you have someone that's a healthcare provider in your family you can go to and consult with all the time. At the end of the day, all of us have our own responsibility for our health. Whatever we get from our healthcare providers and from the organizations that we go to seek health, those are all happening episodically. No one is with you 24 hours a day, 7 days a week, 365 days of the year, except for you. So the decisions you make in terms of your activity, what you're eating, and the information you're assimilating into how you can lead a more healthy life are all really coming from you. So taking these steps of empowering yourself and learning about heart health, learning about how you can improve your heart health and how you can sustain your heart health are really important. And so this empowerment is giving someone, you all, the authority or power to do something, which is improve your heart health. And one of those things about empowering is finding out if you are at risk. Many people are not even aware of some of the risks. Certainly, the things that are usual suspects, such as smoking and weight management, and all those things that have been, certainly espoused and in the news and in the press, and the things that your doctors tell you about, like high cholesterol and fatty foods. Those are all things that people know about, but some people are not aware that beyond cholesterol, even exposure to secondhand smoke can actually be very harmful. So this is one of these times when if you're thinking about, one of the risk factors that you can mitigate, absolutely don't smoke. Another one is cholesterol. It increases your risk. How many people know what their cholesterol levels are and what the differences are between so-called good and bad cholesterol? These are things that you can get information on by asking your doctor or care provider these very specific questions. But also when you look at your labs, or even if you're just going for routine physicals, perhaps asking for some of these things if they're not routinely done. And then, of course, the exercise. A lot of people, again, are not aware that very simple, low intensity things like walking can make a huge difference in their heart health profile. Inactivity actually is one of the greatest risk factors that you can have that contributes to heart disease. We are made as humans to move and to be active. And whenever you're sitting too long or you're not moving, you should be very, very aware that this is contributing to increased risks for heart disease. So you should aim for 2.5, 2.5 hours of moderate intensity aerobic activity per week. And again, it could be something as simple as I'm going to take the stairs today, if it's a few flights. I'm going to walk. These all contribute to improving and maintaining heart health. Maintaining a healthy weight, also another very important factor to mitigate heart disease and complications from heart disease. Having a healthy weight not only makes you feel better, but it also lightens the load and the strain on your heart, as well as mitigates some other risk factors that contribute to heart disease. And of course, diabetes. This is one of those increased risk factors that one has because of this disease. And what diabetes does is it causes microvascular problems, which is just a fancy way of saying that the increased sugar in the blood can cause not only inflammation, but make your arteries susceptible to blockages, which will impede the blood flow to your heart and can contribute to damage. And of course, blood pressure. Many of us in our communities know all about blood pressure. It turns out, though, many people don't know what their blood pressure is. They find out that it's high when they see the doctor. The doctor tells them they have high blood pressure. They may or may not get medication. And then they may not check their blood pressure again until the next visit. This is why it's sometimes called the silent killer. It's not necessarily a symptomatic thing that you would feel. It is something that can go largely undiagnosed, unfortunately. But what it does again is it contributes to the damage of the vessels that feed your heart, as well as contributes to making your heart work a lot harder than it has to because your heart is working against all of this resistance. And there are many things you can do to reduce your blood pressure: medications, meditation, adjusting your diet and your intake of sodium, and so forth. So that empowerment that we just kind of went over are the things that I wanted to sort of highlight and illuminate because they're all things that you can potentially control. Again, you may not be able to control your age. Genetics are not things that you can really control, but a whole myriad of other things, environmental factors, diet, what you do from an activity standpoint are all of the things that can contribute to maintaining a healthy heart. So, in summary, the three simple steps to heart health again are exercise, but not just exercise and intensity and episodic exercise, but consistent exercise is really the key. Eating healthy and things in moderation. And again, your body can tell you, and you are all aware that when you eat things that don't necessarily agree with you, even though they may taste good in the moment, you can feel sluggish and not feel well afterward. And eating things that are healthy absolutely contribute to making you feel better and can maintain and sustain a healthy heart. And then finally, empowering yourself with information. I've been given variations of this talk in many different environments and different settings and over the years. And I think right now we as individuals have access to an incredible amount of information with the dawn and advent of AI and all of the things that are possible in terms of queries. You can really hone in specifically on things that you can do based on your information, your data, and some of the questions that you ask some of these platforms to really get a good sense of the things that will be absolutely tailored and specific and personalized to how you can maximize your opportunity to do the best you can to save your heart from any untoward disease and maintain a healthy heart profile. So with that, I just wanted to congratulate all of you for having this program on Heart Health Month. And certainly Zetas do have heart. We all have heart, but it's really, really important that you think about these three E's and try and internalize and embody them and use them to empower yourself. Exercise, eating healthy, and empowering yourself with information. And if you don't know what your cholesterol is, if you don't know what your blood pressure is, if you don't know if you have diabetes or you're pre-diabetic or even diabetic, these are all things you have power over yourself to find out what your risk factors are and take agency and figure out how you can, one, get informed about all of these risk factors and certainly try and mitigate them to the best of your abilities. And like I said, I wanted to end with a bit of a personal note. Oh, my sorry about that. So I wanted to end with some gratitude and a personal note and hopefully a little bit of inspiration. So this is a picture of me and my team in one of my deployments to Afghanistan. Very bad time during our deployment. We saw a lot of really terrible injuries and it was a really difficult deployment. Believe it or not, these are all the medical people, and you can see we were just finishing up a march here. If you're trying to find me again, I'm the tan fellow with the shades. You see a trend here. And we all had weapons, and we were in a pretty bad neighborhood, we were told. Well, one of the things that I didn't appreciate at the time that I was out there, besides it being very stressful and certainly traumatic, and seeing all these terrible injuries that we were taking care of in a tent, we all came back with you know a little bit of how would I put this? Some awareness that we weren't as healthy as we were when we went out there. And what I mean by that is this was a very dusty environment, and at least my colleagues that I stayed very close with, and many of them I still talk to, we came back with a lot of shortness of breath and not feeling well. And then we later found out that it wasn't probably because of the dust as we thought it was. We were out in the desert and we just thought it was just breathing all this dust. But if you could imagine, you see that wall right behind us, that's called a HESCO barrier. And if you were to go beyond that and kind of look at how the base was laid out, we had tents, and just over some of these walls, we had what were called burn pits. You probably have heard some of that. It's been like in the news now. these burn pits, because we were out in the middle of the desert, was where all of our trash got burned. That's why they called it the burn pit. So everything got burned there. There was no Department of Sanitation that came to collect any of that stuff. So plastics, garbage, paper, fuel, everything got burned in there. And it was going on 24 hours a day, 7 days a week, the whole time we were out there. I was out there for about 7 months. And we've now linked a lot of this burn pit toxic stuff to health conditions. Among them were respiratory things. And up until going to this deployment, I had ran a marathon pretty consistently for many years up until that deployment. When I came back, I just I couldn't muster the endurance to continue running. And it took me a whole 4 or 5 years before I was able to, finish the full distance marathon again. The reason why I'm bringing that all up is because I wanted to ensure or maybe reassure you that even with some disabilities, even with some injuries, even with some setbacks in health, as I certainly experienced, you can still overcome these challenges and take small steps to make a difference in your health. And so this was in 2012. That picture was taken in 2012. I got back in 2013. Like I said, it took me a good number of years before I was able to run a full distance marathon again. As Sora Shirley mentioned, I recently and proudly retired from the Navy in 2023. And just over 50 years old, said I was going to try and do something that I'd wanted to do for a very long time, which was complete an Ironman. And I wanted to prove to myself that I could do something I probably couldn't do in my 20s. And it took me a long time and a few failed attempts, but it really came to fruition. And for those of you who don't know what the Ironman distance is, it's always good to give some perspective. It's a 2.5 mile swim, usually in the ocean or open water. It's then a 112-mile bike and then a full distance marathon. And you do that all in one day and you have to finish it in 17 hours. And I did my very first one a couple years ago after a very long and enduring, kind of grueling recovery from, some setbacks that I have. So I'm putting this up here as an inspiration, and the Ironman mantra is anything is possible. So my point is, if that can be done, you can go out for a walk. You can take in some modification of your diet. You can certainly, empower yourself with finding out what your cholesterol level is, what your blood pressure is on a regular basis, find out what your risk is for diabetes, and certainly mitigate or and try and avoid any cigarette smoke and things like that that can potentially harm your heart health. So with that, I'd love to take some questions and hope we can have a bit of a dialogue and conversation. And of course, I'll put the disclaimer out there that I'm not your doctor, but I'll try and give you some advice and do the best I can to address any questions you have that hopefully will be generated from this conversation. Thank you so much.
Thank you. Thank you so much, Dr. Tanner. And as an attorney, I appreciate the disclaimer. And we do have some questions in the chat. I'm going to go through the questions, but also if you have a question and don't want to put it in the chat and want to raise your hand, come off, show your face a little, we can also do that. But the first question I have is, you mentioned that genetics may contribute to being more susceptible to heart disease. In some cultures, talking about diseases or ailments is taboo or secret. Will genetic testing help to garner information that can help prevent heart disease in families? What ways can one advocate and ask about specific genetic testing to our primary care physician?
Very, very good question. I would say the short answer is yes, testing can help. What specifically are you testing for is a different question, a different matter altogether. That is why one of the things that we do often when you go see a physician or a healthcare provider, there's always a somewhat of a battery of questions about your family history. And one of the reasons we're doing that is a sort of our surrogate test for whether or not you have a predisposition to heart disease. So certainly if you have many members in your family that have succumb to heart disease, that is an indication for us that maybe the patient that we're seeing has susceptibility to or a risk or a higher risk for conditions that predispose them to heart disease. So, for example, one of the things that you can test for is hyperlipidemia, which is a propensity for having higher cholesterol levels and higher lipid levels in your bloodstream, and you can test for that. So those are just, one of the examples. But the question is a very good one because one of the things that kind of goes along with these three principles again, right? Exercise, eat healthy, and empowerment. The empowerment is very powerful because oftentimes when you go see a healthcare professional, you may not know what kinds of questions to ask. So that question in and of itself is a great one. Asking the professional that you're seeing, the healthcare provider, nurse practitioner, healthcare provider, hey, I am concerned about my heart health because I know my uncle, my cousin, my brother, my sister, offering some of this information sometimes can help alert a healthcare provider to the fact that you might be at increased risk if they didn't ask those questions. Many of us sometimes don't know why our family members passed away. We just, we were told that something happened. But if you ask, sometimes you can find out that, hey, there's a trend here. It seems like everybody died of a heart attack and at a relatively young age. That would be something that, you might want to, pay a little bit of attention to and certainly bring to the attention of your healthcare provider. Now, I know all too well the other part of the question was like discussing some of this in certain cultures is taboo, and it's something that is probably not really appropriate or really easy to do. This is why, again, the empowerment part is really important. Sometimes it takes some of our family members understanding why these questions are being asked. And if there is a connection and a link that can be made, like a pattern, like saying, hey, grandma, great aunt, auntie, mama, how did some of these people pass away? And if you see like a pattern, that could be something that could alert and hopefully help to reframe the way that the questions are being asked in a way that makes it a little bit more palatable to discuss. But not easy. I'm not suggesting it's easy at all. But that empowerment part is really important. And that's why I put it there because that encompasses so much. Finding out about your family history, finding about your own history, knowing what your risk factors are, knowing what risk factors contribute to heart health, all these collectively can help. And ideally, you can take some agency in, addressing some of the things that you do have some control over.
Thank you very much for that answer and response. You did mention a test. Can you just say the name of the test again?
Oh, I was just using that as an example.
Okay.
Hyperlipidemia. It's something you can test for. Yeah, there's like a profile for that. But
Oh,
that there's a profile for all kinds of things. We have come a long way in doing genetic testing for different conditions, and it's a great thing. It's something that it may not be something that everyone just should get, but when you have the questions that you are thinking about, and when you have certain patterns that you can sort of find out in your family history, it can help to hone in and help the sort of healthcare team provide a little bit more of a targeted diagnostic strategy for what they can test for and what they should test for.
thank you. Does a normal blood pressure reading change as you get older? Typically, a normal reading is 120 over 80. As you age, does what's considered a normal reading change?
Yeah, very, very good question. So, I'll say the simple answer is your blood pressure can change with age. Um, Now, whether it's normal or not, that all depends. And what I mean by that, I'm not trying to sidestep the question, is this. Our normal blood pressure, as you mentioned, is in that range, 120 to 80, no higher than 120, no higher than 80. And a lot of people are living with blood pressures that are a little bit above that. And you'll hear borderline high blood pressure, like 130, 140 for the systolic, which is the top number, and the diastolic, 80 to 90, which is the bottom number. As you age, your blood vessels become less compliant. So the elasticity of your blood vessels, just like the elasticity of your skin, becomes less compliant. What that means is your vessels become harder and stiffer. And so just from the natural aging process, not to mention the burden of coronary artery disease and just disease burden in the vessels just through age, that all contributes to an increased sort of resistance overall that will increase your blood pressure. So just natural aging can potentially do that. However, we still look at the marker of 120 to 80 as a normal blood pressure. So if you were to trend someone's blood pressure over the entire course of their life, you probably would see a slight increase just because of those natural factors that I mentioned are happening in the blood vessels. Over time, however, your body should adjust. But if you're consistently above 120 and over 180 and you're getting older, we wouldn't consider that just normal. If you start going well above 130, well above 140, and you have high blood pressure, you have high blood pressure, and we should address it and take care of it. And if you do notice that that is the trend that's happening, you should definitely seek help and you should definitely have it treated and try and mitigate that as a risk factor for heart disease because it can contribute to putting a strain and increased burden on your heart.
Thank you. Our next question is CoQ10 beneficial for heart health?
Well, there's lots of evidence that it is. It's an enzyme that helps to mitigate some of the free radicals and the things that could damage your heart blood vessels. Not to get all scientific and be difficult or maybe complicated about it. Again, trying to keep it very simple. There's a myriad of things that could potentially help. Now, there are, I think some pretty good evidence that that can help mitigate some of the damage to your blood vessels in terms of addressing free radicals, which can be a precursor to the things and the sort of chain of events and reactions that cause damage to the blood vessels. And if it's worth anything, again, this is no medical advice, but I do take that every day. I take a, I take a supplement of that every day. Whether or not it's helping, I don't know. But it could also be a placebo effect. But there is evidence that that does help. Yeah.
Thank
Well,
you.
sorry. That's good to know because I just started taking it too. So that's why I asked. And I've been taking it every day now for about a month. So good. Thank you. Mhm.
Okay, so that is very good to know. That is what the doctor takes, and
But I'm not giving any
but
advice.
but
I'm
but no
just-
medical for sure, no medical advice. Um,
Right.
the next question that I have is, what are your thoughts about iridology when considering homeopathic medicine?
Say that again. I think I missed the iridology.
I'm probably saying it wrong, or if the individual with the question would like to come off mic and ask.
Oh, maybe I'm not understanding the question. Is it iridology? I'm not
That is
sure.
correct. Yes, iridology, looking
Oh,
into,
iridology. Okay.
yeah.
Thank you.
And so what's the question? Is it helpful? Is that what the question?
Is iridology helpful in terms of homeopathic treatment?
Ah, I see. I have to say I don't know. I've been a doctor long enough to say I am not afraid to say I don't know. I don't know. I don't really have a lot of experience with it. What I can say, though, not to dodge the question entirely, is that, one of the things that I've learned over the course of practicing now, and even, before being a doctor, like I said, my parents were both from West Africa, so there is certainly some cultural things and many things that, at least those that are probably in the Western medicine kind of domain would have considered homeopathic or cultural or whatever. And here's my take on it. This is kind of like my holistic global view on a lot of things when it comes to health. Humans have been on the earth for thousands of years, right? So we have clearly been doing things well before all these medications have come to be, available to us. And certainly there's a very rich and deep history of healers throughout all kinds of cultures, throughout all kinds of times. And I would never discount any of the things that were done in the past that clearly helped, right? Because some people live very long and fruitful and healthy lives without all of the sort of advances of modern medicine. So I never discount anything. Now, what I do challenge folks to do is that if it works for you and it's not harming you, then it perhaps is okay, right? As long as it's not something that's going to be harmful, I think that, and you feel a benefit from it and it clearly makes you feel better or it addresses something that you're concerned with, then I think that that's probably a good thing. That's just my general take on it. I know some of my, sort of traditional colleagues may be a bit more dogmatic about it, but that's kind of my take on homeopathic things. Does chicken soup work? I don't know, but I know when my mom, my spouse, from them makes really good chicken soup and I'm feeling bad and I feel sick and I have it, I feel better. Now, is it something in the chicken soup? I don't know. So it's one of these things where I don't discount that at all.
So we got vitamins and chicken soup.
Vitamins, vitamins in chicken soup.
Okay, so the next question I have is Dr. Puma, not Dr. Tedder, but Dr. Puma is infamous for his Soren heart scan, and he promoted the heart health for people of color.
Hmm.
Are you familiar with his work? And do you have a take on that?
Yeah, not entirely, but this concept of heart imaging, I am, and there is definitely a place for that. I will tell you that at one point in my life, a few years ago, actually before I deployed, I was having some palpitations myself, and I had a cardiology colleague of mine, and in his sort of workup of all the things that he thought could be causing that. I did have a heart scan, and it turned out to be fine. It turned out to be okay, and we discovered the root cause of my palpitation were probably too much caffeine. It turns out I was studying for a lot of exams around that time. I was drinking a lot of tea. I'm not a big coffee drinker, but I was drinking a lot of tea, and the particular tea that I had a lot of caffeine on it, so I had to sort of modulate that, and that got better. But I learned about heart scans. I know many people, especially because they're commercially available now, have gotten full body scans. Some people just get heart scans. Some people get full body scans, even though they have no symptoms. Certainly, there's pros and cons to doing that, right? The pro is you may get a scan and it doesn't show anything and may give you a false sense of security to say, oh, I'm fine, I'm good. And you might go on doing things that probably are not the best for you. Or it could show something incidental, which probably is benign and probably not a big problem, but now it's caused you undue anxiety and stress, and you're probably trying to figure out, well, what is this that I have? And it turns into a whole big thing and a lot of workup and a lot of anxiety and stress. It may ultimately lead to not being anything at all or something that you just can't ever resolve. So there are pros and cons to these types of things. I think, again, whenever my practice and the way I've been trained and certainly the literature suggests is that if we're going to be doing a test, a diagnostic study in our practice of healthcare, it should be to confirm a suspicion or rule out a diagnosis of something that we're thinking on about based on what the patient's told us. This is why I think it's very important to go back to that third E about empowerment. So during those very critical, very sometimes unfortunately truncated visits with your healthcare provider, you should try and ask as many questions as possible and bring to light things that you are concerned about so that the healthcare team can start to assimilate that information that you're concerned about because it may help us sort of better address your concerns and also have us thinking in a way that, potentially could identify something that we may otherwise have been completely blind to if it was never brought up to our attention. So that's kind of the way I look at some of these diagnostic tests. I think that if it's done in the context of a symptom, a concern, perhaps a family history, or some other mitigating risk factors, then I think it's good. But sometimes to just get a test with no symptoms, it could lead to a false sense of security or potentially identify something that's probably not a problem, but just causes a lot of problems in its workup.
So I think my takeaway from that is ask your doctor all the questions, right?
Well, as many as you can, yeah. And obviously, it's sometimes not feasible to ask everything, but in that limited time and in the context of, why you're visiting, if it's a routine thing, then, try and, catalog or document things that you are concerned about over time and kind of bring that to the person's attention. Because, you've probably all experienced in this day and age, like when you go visit your healthcare provider, it's really, a constrained time. I mean, if you're very fortunate if you have doctors that can spend a lot of time with you and ask you a lot of questions, and you're even more fortunate if you have somebody that's been with you and has followed your health and your life all, over a number of years so that they can really get to know and understand, what your health condition is and how things are changing over time. That's the ideal situation, but not everyone has that luxury.
Thank you. Can you explain congestive heart failure?
Yes. So congestive heart failure is when the heart is failing. We call it congestive because the heart is a pump, right? And if you think about a failing pump, whether it's in a mechanical situation and unfortunately in the body situation, it leads to lots of problems. So when you think about congestive heart failure from a clinical picture, when we are like looking at someone with congestive heart failure, the congestive heart failure part of it is the fact that fluids are starting to build up because the body is not pumping the blood as it should. The heart is failing, and you can start to get sort of an engorgement of different domains of your body, like your legs and your feet will start to swell. You see that that's kind of one of the synchronon things for congestive heart failure. People may get short of breath because their lungs are filling with fluid because it's backing up. And it's a whole kind of sequela of other things that lead, unfortunately, to a lot of debilitation. And congestive heart failure can be caused by a number of things. A lot of times it's because of ischemic disease. And what that means is that over time, there may have been blocked vessels and damage to the vessels of the heart that feed the heart with nutrients and oxygen that cause damage to the muscle. So the muscle starts to die, become damaged, and over time doesn't function as well. And over time, the heart becomes less efficient at pumping, and then it starts to get larger. The muscle doesn't squeeze as well. The pump starts to fail, and you start to get all of these symptoms. It could also be idiopathic, meaning that it just starts to fail over time. Sometimes with age, it could be viral, sometimes it could be an infection. So there's a lot of different things that cause heart failure. Um, One of the things that we like to do when we are taking care of patients is ask about these kinds of things. So you'll probably have heard when you're getting sort of a physical exam, particularly if it's like a heart focus thing, we'll ask, do you get short of breath when you climb up the stairs? Do you notice that your feet swell if you stand for long periods of time? Like all of these things are asking sort of root cause questions to sort of ascertain how your heart is functioning. We'll also ask how your exercise tolerance is. Can you walk down the block without feeling short of breath? Not even stairs, something just light exertion. So all of these things kind of give us some indication. So I know that's a long-winded way of answering the question, but it's sort of an umbrella term for a failing heart. There could be a myriad of reasons for why that is, but at the end of the day, a failing heart leads to a number of symptoms and unfortunately can be a very morbid thing and can ultimately lead to mortality as well.
Thank you. Thank you for that response. I have a few more questions. Are there ways to improve cholesterol?
Yes, there are ways to improve cholesterol. So one of the things that, I brought up before was making sure that it's not a genetic predisposition. Some people actually at very young ages can just have really high cholesterol, and that could be because of conditions called hyperlipidemia, which I touched on before. But for the sort of general population, when they have identified a high cholesterol, and again, there are different kinds of cholesterol, but usually we're talking about the cholesterol, just cholesterol, and it being high. Once that level is identified as being high, there are things that you can do to lower it. The first thing is always diet, right? Everyone will say, well, you need to lower the amount of cholesterol that you intake. I'm kind of smiling because just recently I heard a comedian, Cat Williams, talk about cholesterol, and he was making a joke to find out that he said, well, the brain is cholesterol, so why are we talking about high cholesterol? Well, that is true to some extent, but the cholesterol that we're measuring in the blood has been shown to potentially cause damage in the blood vessels. That's why we have it set at a certain level. Like if it's above 200, that's considered high, and we like to have that lowered. So diet would be the first step. Exercise can also help lower cholesterol, believe it or not. And then, of course, there are medications that can help reduce the amount of cholesterol in your bloodstream. So yes, you can do some things to lower your cholesterol.
Okay, thank you so much for that response. What recommendations, understanding you're not providing us with any, more specific advice, but what recommendations do you have for lowering blood pressure for someone who wants to wean themselves off medication?
Very good question. I'm going to use myself as an anecdote as well. So one of the things you can do is certainly diet. So I'll go back to my three E's. So the three E's are the following. So you have high blood pressure, you're taking maybe a number of medications, and you want to lower your blood pressure. So the first thing is, of course, exercise. Exercise could actually help lower your blood pressure. Now, it's actually counterintuitive because if you ever put a blood pressure cuff on your arm, on your leg while you're doing exercise, you'll notice very routinely and physiologically appropriate that your blood pressure will go up. However, if you continue to do consistent exercise over time, your capacity and your compliance and your efficiency for your heart all get better. That all contributes to lowering your blood pressure. Remember, I said the body doesn't like to stay still. So that the more you're staying still, the more problems are probably going to occur. So exercise is one way to certainly lower your blood pressure. And again, it could just be consistent cardiovascular, simple walking could be enough. Things like sleep go into this sort of equation. I'll kind of bucket that in sort of like the exercise part. If you have sleep apnea, you can address sleep apnea. That contributes to high blood pressure. So you have to get tested, and that goes kind of to the third E. Eating healthy is very important too. So sodium, high intakes of sodium can increase your blood pressure. And there are medications that you can take to reduce that as a risk factor. And of course, you can have less salt intake as a diet. So exercise, eating healthy, and then this empowering part is really important. So I mentioned sleep apnea. Some people don't know that they have sleep apnea. People are like, what is sleep apnea? Well, it's the interruption of air and circulation while you're sleeping, and it causes you to have these sort of like micro awake moments that all contribute to a physiologic state that can be unhealthy, interrupting your sleep so you're not really well rested, um, depriving organs of oxygen temporarily. That also contributes to problems. It can lead to other issues as well. So empowering yourself is one to figure out if you do have sleep apnea, and you can find that out by asking to maybe the person that sleeps next to you, or has anyone ever heard you snore, and you can get some tests and you can address that. And then, of course, all of these other things that we talked about. Are you smoking? Well, you should stop smoking if you have high blood pressure and you are taking lots of meds, because that would be certainly something that can, help address that. Nicotine is a vasoconstrictor, so as soon as you smoke, your blood vessels squeeze, raises your blood pressure. Finding out if you have other risk factors for elevating blood pressure, like a family history, that could also be something you can mitigate. And then the other things that you can do besides exercise, eating healthy, are things like meditation and reducing stress. Easier said than done. I do meditate. I meditate daily, and it helps me quite a bit. My family has had a history of high blood pressure, and there are things that I've done along those three E's to help mitigate, my risk for that. So trying to eat as healthy as I can, exercising, as much as I can, trying to reduce stress, trying to get good sleep, something that I'm always struggling with because I always have a lot of things going on, but also meditation and trying to minimize stress as much as possible. So all those things can be factors that contribute to reducing your dependency on medications and potentially eliminating them altogether if done in concert and with the cooperation, sort of partnership with your care provider and your team.
Thank you. And in line with that question you just answered, are there any side effects to the medications that are prescribed to lower cholesterol and blood pressure?
There are side effects to every medication. Yes, absolutely.
Okay.
Um, that's unfortunate because that's some of the reasons why over the years taking care of patients, I realized that some patients are not compliant, and compliance just means like taking the medication. We prescribe in healthcare all kinds of medication to people, and we in our minds think, well, we read the studies, We know what these medications do physiologically, and if our patients take them, they'll be fine. And the reality is not necessarily, because sometimes the patients may not be able to get medications for a number of social, sometimes economic reasons. And sometimes they do get the medications and they take it and they start to feel poorly or have headaches or they have dizziness or they have a plethora of other things that may or may not be contributed to, may not be related to the medication, but they may attribute it to it. And as a consequence, they'll stop being compliant or just discontinue it entirely. But all medications have side effects, unfortunately.
Okay, thank you. I see that Wanda Sharif Rodriguez, you have your hand up.
Yes. Thank you for that information. And I just wanted to ask you to reiterate the importance of the silent killer because uh, I can say when I was 30, in my 30s, I went for regular examinations and found that my cholesterol was over 212. And this is after walking in and always getting tested, but for whatever reason, it was 212. And then after realizing, because actually I'm a scientist at a pharmaceutical company and I work in the area of cardiovascular and kidney diseases. So I am familiar with the fact of the silent killer. The first thing I did was call my dad and I found out that he's on statins. So
Wow.
once I realized that my dad was on statins, I knew that this was genetic and I didn't have to get genetic testing to know that part. So what I did was I was put on a statin and as a scientist, because scientists are working on, I guess, therapies that are not having the most side effects, biologics have been things that we've been working on, and biologics do target to where we're trying to make things that have the least amount of side effects, and they don't have the same side effects or have the least amount of side effects compared to most of the small molecules. So just so that people know the importance of, I had people in my family who take half of a pill because they feel like they're doing all right and all that stuff, and they're not talking to their doctors. And the importance of like, she would take, that's great that you can take a homeopathic medicines, but if you are not being straightforward with your doctor, you're putting yourself in danger by reducing medication on your own. And also, there are things that are out there, and you could talk to your doctor about maybe trying something else. A different approach if you feel that something's not working for you. But I would say not to mess with the silent killer. I also lost a best friend who's also a soror. Her name was Tara, to that silent killer of cholesterol that caused for her to have a heart attack. So those were all signs of the importance of just treatment and just please reiterate how serious it is that even though we want to, not be on medications and do things, we definitely need to converse with our doctors. And there are things out there that may be better treatments nowadays. We're getting better and better with the way we're treating.
Yeah, that's 100% true. And thank you for sharing that story. It goes back down to that empowerment. I try to keep this very simple, but I think you're illustrating exactly how important empowerment is. And when I mean empowerment, I mean that is really a weighty term, but it means that going back to my example of you are the CEO of your health. So your example is excellent because you were getting information all these years. And not everyone knows what the normal levels are. I mean, most people didn't go to med school. They don't know. They're not, you know, asking the questions because they don't know what the normal levels are. And it could be that either, the doctors thought that you knew or didn't know, but you have to be responsible for everything. So when that slide that came up showed that high cholesterol could be a risk factor, well, the first question you have to ask yourself is, well, have I got my cholesterol tested? I don't know. Well, there's your empowerment, there's your agency. Next time you're seeing someone, say, I'd like to check my cholesterol. It may be that it was checked, but now you can have that conversation. Well, what's the level? Is it trending up? Is it trending down? Is it normal? Is it high? And then you can have bigger conversation of like, what can I do to address it? So empowerment is very important. Always, always, always take full responsibility for your health. You don't have to be a doctor to take responsibility for your health. You should never be a passive patient, like just let things happen to you, or worse, not even know what's happening. So try your best to know what's happening. And then if you do have questions, find people that can give you the answers to the questions. And if it's not your doctor, find another doctor. If it's not that doctor, go find somebody else. But you should really take agency and try and figuring out what your risk factors are, knowing where you stand with all of these risk factors. And again, kind of going through those three E's again. You have a lot of control over what you eat. You have a lot of control over your activity, and you absolutely have a lot of control over how you um, sort of have agency over your health by knowing what your risk factors are, and of course, reading about them, and then learning about specifically, what things are placing you at risk for heart disease.
Dr. Teta, I do have two more questions. Uh,
Okay.
this one is, can you explain what a consistent LVEF of 25% or less on an echocardiogram mean?
Oh, well, if that, let me clarify before I answer the question. LVEF to me sounds like left ventricular ejection fraction. Is that the right question? Okay.
Yes,
Now, is this, before I answer the question, is this something that this individual has, or they're asking on behalf of somebody else?
it's a question that was presented to me. I don't know if they
Okay, well,
were
so
specific.
your left ventricular ejection fraction is the amount of blood that is being squeezed out of your left ventricle when your heart contracts. Usually, we measure that on an echocardiogram. That's kind of the study that you get. It's kind of like the ultrasound. When you are looking for a baby, you use ultrasound for looking at vessels. You can look at it for heart function. That is low. First of all, let me start there. That is not a normal ejection fraction. Ejection fraction is much higher. The ejection fraction is not 100%. It's never that you have 100% of the blood kind of going out. So just to qualify there, but usually 50 to 60% is the normal range of ejection fraction. So if it's lower than, those numbers, that's usually a concern. And that to us is an indication that the heart is not working as normally as it should. Now, I don't know why that is. You have to investigate that, and I'll have to have a little bit more context and sort of information to understand and maybe address why that could be or offer some suggestions for what could be done for that. But yeah, that is a low and not normal,
So
at least in our normal range. Yeah.
thank you. And I have one additional question that came in through the chat. There are so many supplements on the market now. Do supplements really help, or are they a waste of money? What can we do to get those vitamins and minerals that are lacking in our diet?
Oh, well, that's an easy question. Eat good
Yay.
food. Yeah, eat good food. Yeah, how you get all the, if you talk to most nutritionists, they'll tell you there's no need to have a supplement if you eat healthy, right? Not easy to do, as we know. Not everyone has access to fruits and vegetables, and we have a culture and a bias in our society to take a pill for everything because it's just easier to do that. Obviously, eating whole foods, all those nice green and very colorful foods that I showed in that picture. That would be great if you could eat like that every day. You probably never have to take a supplement. But the reality is that's not necessarily the thing that's feasible for many people. So the question is a good one. Do supplements help? Again, I shared with you that I take one, so I would be a bit disingenuous if I said, "Oh no, it doesn't help." Well, I don't know. There's also a placebo effect to some of these things. Sometimes people take things and they feel better and they think it's helping them. Is that wrong? I don't know. My take on the supplements, though, is if you're taking supplements in lieu of eating healthy, that you should not do. You should try and eat healthy. And then if you really do believe you have a deficiency, which can be diagnosed, I mean, you can do blood tests to find out if you have a deficiency in magnesium, if you have a B12 deficiency, like all of these things that you can take as a supplement, then yeah, by all means, supplement. But you need to know, it goes back to that third E, empower yourself. It's not, in my opinion, wise to just take a bunch of supplements without really understanding if you're even deficient in any of it, because in that case, you will be wasting your money. And certainly, because supplements are not regular drugs like the kind that that go through an FDA approval process and get screened for efficacy and for risk factors and for harmful effects, you should always do that with some caution, particularly if you're taking something that may not necessarily have good labeling. It doesn't have like a lot of information about where it comes from and how harmful it could be, because the last thing you want to do is take a supplement that you think is helping you and you turns out that it's doing something that's harmful. So.
Thank you so very much, Dr. Tedder. I believe that I got all of the questions in the chat, and thank you to
All
everyone
right.
reminded me if I missed a question. I just want to give a last opportunity. If you have a final question, if you could raise your hand and we could do one more question. And if not, just would like to say, do we see anyone else with any final questions?
No, I don't see anything else in the chat.
Okay. Well, there you have it. You've answered all the questions, Dr. Tedder, in addition to your presentation. So thank you very much from the bottom of my heart. I truly appreciate your talk this evening.
Oh, you're very welcome. Well, thank you for the kind invitation. I hope this was helpful. I hope it uh, becomes something that you take to heart, exercise, eat healthy, and empower yourself. You have all the agency over your health, and you should all consider yourselves the CEO of your health. And, these days there's so much information that, you have access to really help mitigate risk factors and help you live a very healthy and heart healthy life. So, in any way I can help, I'm really happy I had the opportunity to do so.
Thank you.
Thank you.
I see a shout out
Thank
for Spring 91.
That's right. Spring 91.
Oh, well, thank you. This was a very motivating and inspiring conversation. So, on behalf of the entire Zetas Have Heart Committee, thank you so much for your time. And I'm sure we left here with a lot of great information, and everybody's ready to, like you said, take charge of our heart health. So, thank you.
And remember, anything is possible. That's why I showed that picture at the end, was to inspire you. It's possible.
Yes,
You can
that's
just go
right.
out and just start walking and, little moderation in the diet. Yeah, anything is possible.
Thank you.
All right.
All
So,
right.
Thank you
Everyone
very
have a
much.
great night. Thank
okay,
you.
take care.
Bye.
Thank you. Surely we can stay on until everyone
Okay.
logs off.
If
Mhm.
we could just stop recording.
Oh, yeah. Mhm.
Thank you so